Today's program is probably like no other around the country, and I do a lot of traveling around the country, and I don't know of another group that has brought together the leaders of 30 nonprofit organizations to come here today as representatives of the community, and hopefully to bring the information that you learned today back to the community you serve. The symposiums are really to bring patient safety to the community level. When we talk about patients and family members, I'm talking about the cashier in the supermarket or the person next door. Today's program is not just about a lecture, it's more of a working group. Each healthcare professional had an opportunity to talk about what they do. Then they break out into groups and they can have a conversation with the professional to answer their questions.
We want to make sure we know who we're targeting, right? Who are we sampling? My role is to bring a sense of what it takes to do research and evaluation in healthcare settings. Most nonprofits don't have the human resource and fiscal resources to carry out research and evaluation. And so oftentimes they have to take shortcuts just because that's what they have. I'm curious to hear about what they actually do in practice versus kind of what the best practices are in the field.
I'm going to let people know about common errors and what they can do to prevent those, but also less common things that they haven't heard about. So I think they'll really appreciate understanding what they can do and how, as active participants in their care, they'll be able to improve their outcomes, engage with their providers, and really set goals for their care, which are going to help them do better in the long run.
Maybe we didn't quite understand the instructions of what we were supposed to do concerning our particular disease or illness.
The symposium will talk about health literacy issues, right? So that people understand their instructions, if it's medication, or if a family member understands if it's a particular medical condition, what they need to do, how they should communicate with healthcare providers. Everyone has been affected in some way. Somebody knows someone else who's been in a hospital.
Patient safety is a topic which weaves itself throughout healthcare in many ways. It's more than a single discussion or a lecture. It is a commitment we make to each other, regardless of the role we are playing at the time of the interaction.
Most of our volunteers have had some experience or some curiosity about patient safety or the errors that happen.
I'm the crisis planner by profession, so I help people prepare for life's disasters. And last year I actually lived two of those major disasters. I lost my husband last year to an adverse drug event. He had an allergic reaction to an antibiotic, and he eventually succumbed to that reaction. And I also lost my mom to Alzheimer's last year. I love what Eileen is doing with patient advocacy and safety, because there were so many things that went wrong at the hospital and in the emergency room. And even though I have a huge background as having been a pharmaceutical rep for 22 years with medical stuff, there were still things that I missed.
My child tested positive for galactosemia, which is an inborn error of metabolism that makes them unable to metabolize the sugar in milk. They did unanesthetized surgery to clean out all the dead muscle tissue on his arm, and he went into kidney failure, he had visual failure, he had seizures, and nothing that they did helped at that point, and he passed away within 24 hours of going into the hospital. In retrospect, there were a lot of things that could have been done that just weren't done. They didn't think about it, and I was a couple of days out of childbirth with a cold and not really thinking clearly, because I had never had something like this happen before. And I was being as proactive as I could be by calling them, but the fact that they were not responding, I didn't know how to go over their heads or how to push it harder. Since then, I've been an unofficial advocate for several members of my family, because I can say that almost every hospitalization has at least one potential error. Whether it's wrong medication, something that's not being followed up on. So for close to 30 years now, I've been paying attention. And when I met Eileen and she told me her story, I was like, yeah, this is something that definitely requires attention.
It's one of the things that Pulse really educates people on how to do it properly, how to get the right information and understand the options so that they can make informed decisions with their loved ones. In my husband's case, the reaction he had to this medication was so severe, it should have been treated much more aggressively than it was.
You really do need to be vigilant, and very often the patient may be sedated or just not feeling well, or for whatever reason, you can't really count on the patient being able to be on top of it. The people around them need to be.
If we could focus on the conversation of medical errors, of patient safety, and how to prevent it, we're not talking about blame. These things happen. It's the same reason we wear a seatbelt. We put on a seatbelt because, not because I'm a bad driver, but what somebody else might do, what might happen.
If we're a doctor, we need to understand what it means to be a patient. If we're a patient, it's very helpful. It will make you a more effective individual if you understand a little bit about what it means in terms of the different professional roles and challenges.
The doctors that spoke here were wonderful because they were able to give us a lot of websites, a lot of further information, and actually make themselves available to us as well.
A great homework assignment for you would be to go to the consumermedsafety.org and look at the material that's there that I think you could print out and would be of help.
I have 5 sons, and therefore I had to administer a lot of medication to them in their youth, and so I want to learn. I learned today from the speakers already about medication labels and dosage.
I'm getting a lot of older population dementia patients, and I started doing some home care also. I felt it was like a holistic approach, and I felt that this would really help me talking to the families.
For me, it's as much of a learning opportunity to hear what people here want to get out of it and what they bring. And it's not about me, it's about understanding them and hearing what they want to get.
I love the symposium format because it really is like the ultimate mastermind, where it's an exchange of ideas and thoughts and solutions to problems, looking at things from ways that maybe you haven't approached it before.
The panel was great. I learned a lot, and I have a lot of ideas, so I want to have part of my workshop now. I want to implement a whole section to patient safety as far as medications is concerned.
We came here on the blank canvas, let's fill up our canvas and see, what we take home. And so I think it ran out over the page.
I didn't know what to expect. This was my first time coming here. I had a general idea, but this was much more than what I had expected to learn.
I wish I could have been at all 4 tables because each one of them brought such value to the conversation. It's something that has to constantly evolve. It's not static. And I think that's the thing that we saw, that there is a fluidity to it, and the more voices that are speaking up, the better care we're going to get, and the better care we're going to be able to make sure that our loved ones get.
I can't thank the sponsors enough, because without the sponsors, we couldn't be doing this. And that's an important piece of this, is donations. We're 100% nonprofit, run by donations and small grants. With that support in the community, we can continue doing this work and spreading our mission.